Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over melanoma. Okay, so we're going to be going over the ABCDE'S, and it's a tool used to recognize melanoma. Okay, but first, if you could hit that subscribe button, it would be greatly appreciated as it does help my channel reach more people. So let's get started, guys. So what is melanoma? So melanoma is a type of cancer that begins in the melanocytes. These are what make the pigment melanin. Okay. So melanomas often start in moles on the skin. Okay. They can start in other parts of the body that have melanocytes. So the fingertips, toenails, eyes, GI tract. And rarely they do form in the nasal passageways, sinuses, and genital areas. Now, melanomas can spread, so metastasize to other parts of the body also. So risk factors. Each year, doctors diagnose almost 100,000 new cases of melanoma. Okay, and that's just in the United States. Your risk of melanoma diagnosis goes up as you get older, but it truly can happen at any age. So what are some of the known risk factors? So having fair skin, so skin that burns or freckles easily puts you at higher risk. A family history. So if your parents or siblings are diagnosed with melanoma, although this does not mean that you will get cancer, but it does put you at a higher risk. Moles. So having a lot of moles increases your risk. Personal history. So if you've had melanoma one time, you can get it a second time, third time. Okay. Severe burns. So having at least one severe burn as a child, teenager, adult, it will increase your risk. So some protective clothing can help reduce the risk. Ultraviolet radiation from the sun. So where you live really does matter. Levels of UV radiation are higher in places closer to the equator. They also increase as the higher the elevation you are. Okay, sun lamps, tanning booths are also they also use ultraviolet radiation. Okay. A weakened immune system. So certain drugs, diseases weaken the immune system and can increase the risk of melanoma. Okay, so now signs and symptoms. So if you notice that a new mole has popped up, or an older mole has started to change in size, shape, or color, or it starts to feel different, it itches or oozes, it bleeds, anything like that, are a sign of melanoma. Now, we do have this little chart here. It's called the ABCDE'S of melanoma. It's a guide to help find moles that may be cancerous, okay? So if you notice any of these, please contact your doctor or dermatologist. So we'll start off with asymmetrical. So it is not symmetrical, so it's not a perfect circle, okay? The border, so it's not it's not a circle, okay? So it's notched, blurred edges, it's uneven. Even sometimes the color starts bleeding into the other tissue, okay? Color. So if you're noticing different colors in that mole, diameter. So once you hit 6 millimeters, so anything over 5 millimeter mark, they are easier. That's when they do become melanoma. Okay, so it's not really the size, but the larger in size that they are, it is a sign. Okay. Now, is it evolving over time? Okay, so is it getting bigger? So what you should do, you should be checking over your body once a month. You can even take pictures of any moles that you're kind of questioning, like, is it getting bigger? Whatnot. You can take measurements if you're worried, but taking moles can help keep track. So diagnosis and staging. So your doctor will look at the mole very, very closely. They may use special glasses. If the mole looks suspicious, your doctor will suggest the biopsy. So this can be done one of two ways. The first one, they'll remove the entire mole and some of the skin around it. A pathologist will examine the tissue under a microscope and check for cancerous cells. Next, we have a biopsy. Your doctor will remove a small piece of the mole, and a pathologist will examine it underneath a microscope, check for cancerous cells. If cancer cells are found, you will be told that you have melanoma. You will also learn how thick it is, how fast it's growing. Your doctor will use this information to stage the melanoma, and it will also guide treatment options. Cancer stage sums up how far the cancer has spread. Okay. So there are 5 stages for melanoma, stage 0 through 4. The lower the stage, the less your melanoma has spread. So treatment. So surgery is used to treat melanoma that has not spread, okay? So has not metastasized to other parts of the body. Your surgeon will remove the cancer. They will also remove an area of normal tissue that surrounds it, okay? This is called the margin. If a surgeon removes a large amount of skin, you may need a graft. So they'll just take skin from another body part and replace where the melanoma was. Okay. Your surgeon may also remove lymph nodes near the tumor. Cancer cells can move to other parts of the body through the lymph nodes. The lymph nodes are sent to a pathologist to look for cancer cells. This will help your doctor know how far the cancer has spread and help determine what the best course of treatment is. Okay. Radiation therapy is sometimes considered after surgery. When it is used, the goal is to help keep cancer from coming back. Targeted therapy is a type of cancer treatment that targets a specific change in cancer that helps them grow, divide, and spread. Targeted drugs are designed to block cancer growth driven by these changes. Immunotherapy uses a person's own immune system to recognize and attack the cancer cells. Chemotherapy. So this is one of the most well-known systematic therapies. It's not often used for melanoma, but it is used sometimes after other treatments have been tried first. So I hope this video did give you a better idea of melanoma and how you can look for it at home and determine whether you should be talking to your doctor or not. Now, if you ever have concerns about a mole, please just get it checked out, and the doctor will be able to, make their suggestions or do a biopsy if needed. But that's all I have for this video, guys. I hope to catch you in my next one. Bye for now.